Hi guys, it's only a short video this week. I really want to talk about side effects. I was looking at the paperwork for a lot of these, and as I explained about my blood disease, the reason I couldn't take ribavirin or ribavirin, what anyone wants to call it, is it reduces the blood cell count. Well, that is not obviously good for me. So, excuse me while I unwrap this. I was looking at all the possible side effects of both of these, and the usual ones are fever, chills, flu-like symptoms, diarrhea, feeling sick, nausea, being sick, trouble sleeping, insomnia, feeling tired and irritable, headache, rash, itchy skin, loss of appetite, feeling dizzy, muscles aches and pains, pain in the joints, shortness of breath, or a coffee. Blood tests may also show low red blood cell count, anemia, which I'm terrified of. The signs may include feeling tired, headache, shortage of breath when exercising, low white blood cell count. The signs may include getting more infections than usual, which is normally my sign, including fevers and chills, sore throat or mouth ulcers, low blood count, platelet count, changes in your liver as shown by increased amounts of substance called bilirubin in the blood. Now, that one is for Sufosvivir, and not too bad. The other one, which is for the Declatisvir, pretty much the same side effects. They really go overboard, don't they, on these paperworks. On Declatisvir, possible side effects: decreased appetite, difficulty sleeping, dizziness, migraine, shortness of breath, hot flush, itching, dry skin, unusual hair loss or thinning, which actually, to be honest, I wouldn't really notice, rash, diarrhea, upper abdominal pain, constipation, excessive gas in the stomach or bowel, heartburn, vomiting, cough, nasal congestion, a blocked nose, dry mouth, joint pain, aching or tender muscles not caused by exercise, depression, anxiety, irritability, reduction in red blood cells, which is what does worry me. It says when this one is used together with interferon alpha and ribavirin, the reported side effects are the same as those in the package leaflets for these medicines. Very common is decreased appetite, difficulty sleeping, headache, shortness of breath, nausea, fatigue, flu-like illness, fever, itchy dry skin, unusual hair loss or thinning, rash, diarrhea, cough, joint pain, aching or tender muscles, irritability and reduction in blood cells. Those are the most common side effects. Now, I've only been on these a week, and already the first day after I started them, I had to go on anti-sickness pills. And first of all, they tried me on cyclazine. Didn't do any good, didn't touch it, because it's not a travel sickness, it's a medication sickness. So they've changed me to metoclopramide, which is slightly better. Still getting the sickness. I'm not vomiting, which is good, but sometimes I'd rather be like that than feel actually sick. The tiredness, I'm getting extreme tiredness. They're not doing a viral count on me. They done a blood test this week to check on my bloods, obviously, to make sure it's not going anemic, which seems pretty much okay at the moment. My ALTs have gone in a week from 139 down to 38, which is very good. But then mine have done this before, and then they'll go back up to like 200 and something through the roof. So my hemoglobin is at 123, which is lower than what it was, and my white cell is normal, which is lower than what it was. So for a normal person that would be fine, but with my anemia, being that I will get hemolytic anemia, which is extremely dangerous. Not so good. It's good, but I wish my levels weren't quite so low so fast in a week. But we won't really know till next week. I'm getting the complete and utter tiredness, the muscle aches and spasms. My actual back went out for 3 days. So, excuse me, I think my dog's just going to vomit. No, he's not. My back went out for 3 days, and what it was is the muscles spasmed and contracted, and I couldn't move my back. Extremely painful. I take 2 milligram of diazepam at night for that, because even if I lay flat, it's way too painful. So my trouble is nausea, which they're giving me tablets for. Now, I went to see the doctor, my hematologist, before I saw my hepatitis nurse, about my spleen, and wasn't good news on that front. My spleen has totally stopped working. Can't take it out, too dangerous because of my liver. So I'm now on 250 milligrams of amitriptyline. Not amitriptyline, why do I keep saying amitriptyline? Amoxicillin a day for the rest of my life, because I'd have to have it anyway when my spleen's out, but my spleen's actually not working because I'm just getting every virus that is out there. I don't even leave the house and I'm getting them. If Alan goes somewhere, Alan's now been told he's got to wash his hands before he touches me, etc., etc. And this is one of the reasons why it's such a big problem living in such a small flat. He's now having to sleep in the living room on a sofa bed, which we had to buy because the council won't move us, in case he ruptures my spleen during our sleep by just turning over and flopping his arm out or something. So it's a bit of a worry on that front. We tend to sleep in shifts anyway, because like most of us, I get insomnia. Actually, that is the one side effect that has got better for me. Where I'm getting the tiredness, my insomnia is not as bad as what it was when I didn't take the medication. So I don't know which one's better, but it's obviously working because, my ALTs are down. At the moment, my bloods are okay, but it will tell next week. Next week is when I get my viral count from what it was to what it has become. And I did ask and say, well, if I'm okay by like SVR by 12 weeks, do I still have to take 24? And because of my spleen and because of my blood, yes, I do have to take the whole 24 weeks because they do not want it re-emerging. Not that they're definite that that's going to stop it. Excuse me. Gas. Not that that's going to stop it re-emerging if it wants to, but it will give me a better chance. So that's where I'm at this week, guys. I don't have the itchiness. I have a headache, but it's not a migraine. If it was a migraine, trust me, I'd know. I do suffer with them, but this isn't. It's like, your eyes, like as if you've got tired eyes. It's sort of across here and round here. And I thought it might have been sinuses as well, because it was round here, and I've had that that runs in our family. But no, it's not. It is the headache from the medication, and all I can take for that is paracetamol. I'm actually on so many pills now, I don't know whether I'm going upside down or back to front. I actually got myself a little medical box, this one, and the reason I got this one is because I've got to fill it out yet. Up here I can put in all the medication I'm on. So when I go to the dentist, she always asks me, bless her, has your medication changed? And I can say yes, and I'm now on da-da-da-da-da. Because I don't know about some of you guys. I don't know if this is a Hep C thing or just me, but when I go to the dentist, if I have to have an injection, I cannot have, what's that stuff? I have to have the one without it. The stuff, brain fog. It'll come back to me. Anyway, one of the injections I can't have. It makes me have like a fit. And it's like my body overdoses on it when they give it to me, as if I've got adrenaline. I can't have the one with adrenaline in it. And my body goes totally uncontrollable and shakes, and all sorts of horrible things happen. In fact, one dentist didn't believe me and they had to call Alan, and he had to hold me down with the dentist and everything because I was nearly falling off the side. I don't lose consciousness or anything like that. But what happens is I think the adrenaline is far too much. I produce enough anyway without the extra, and I just think it overdoses me, and my body just literally shakes, rattles, stirs, and everything else. So that's pretty much what's going on there. So hence why I got that, because my memory's getting bad, and I'll be honest, some days I think, have I taken that pill? Haven't I taken that pill? So I used to have one ages ago, and then I stopped using it for a reason. But this one I particularly like because it's got a piece of paper in it, and you can write on what medication you've got and who your doctor is, etc., etc. So to me, that's very handy. So I will be using that. And it has made it easier, to be honest, rather than keep thinking, did I take it? Didn't I take it? Especially when you're on a regime of painkillers as well, like morphine, because sometimes at night I can be tired and I'll forget, and then I'll wake up in the night in absolute agony and starting to go into withdrawals because I've been on morphine so long. I'm only on 15 mil or 30 mil twice a day. It's not very high, but it's enough for me, and it's enough for my body to get hooked on it, and it is my body that's hooked on it, unfortunately. But the withdrawals aren't very pleasant, so this is a good way of helping me stop forgetting that. In fact, my memory got so bad lately. Now, I've had the same bank PIN number for banking online for, I don't know how long. I actually input it wrong 3 times today for the first time ever, and I've locked myself out of my bank account. So, online. So it just goes to show how stupid my memory really has got now. I even wrote it down, and I couldn't remember where I put it, where I wrote it. And then I found where I wrote it, tried to put it in, and it wouldn't let me because I'd already done the error 3 times. So, yeah, it's all fun and games. But quite honestly, the side effects that I do have are not very nice. I'd like to sit here and say, yeah, it's all lovely, I've got no side effects. But the Sufosvivir and the Declatisvir, yes, I am having side effects. The ones I'm having are not very nice. I do have gas as well, but I won't go into that because I don't want to embarrass you or me. But I'll leave it up to your imagination. And other than that, yeah, that's pretty much where I'm at the moment. So my bloods are stable. My ALTs have dropped over 100 or 101 or whatever it was, which is great news. And next week, sorry this video is late this week because I've been really running around and I'm so tired. I've had so many appointments with doctors, nurses, and God knows what else this week. So next week I'll be able to give you, it'll be sooner than a week, and I will give you my results of what my viral count load is. So thanks for listening. Oh, I just want to show you this. Alan bought me this for Christmas. He's dead cool. I collect nutcrackers, by the way. I love them, but they have to be real ones. You know, like his mouth opens. They have to be real nutcrackers, and I have a whole army of them. But this is the first white and green one I've got with a hobby horse. So I do love my nutcrackers. So it kind of suits me. So I'll speak to you guys next week. Thanks for watching. Bye.